What's up, you guys? This is your boy Miguel, giving you your daily dose of radiation. Today's video, we're covering how long does it take to get all of your X-ray checkups, comps, whichever ones, your performances, your efficiencies, whatever they call it in your place of education. So to give you context, I'm an X-ray tech. I work night shift, dabble in day shift a lot of overtime. So the one reason everyone goes is to get checkoffs. So it all kind of depends on, I would say mainly, it's like three different things. Depending on how big your site is, if it's a floral site or it's mainly like an ER outpatient. So those will kind of determine what kind, how fast, and what you will see. And then the other one that comes into play is your techs who are with you. So I would say all those are kind of variable. Some of them basically all those you can't really control. All you can do is make sure that when anything spawns in, to make sure you have the knowledge and you know how to do it, or you ask all the questions before you do it, so you can make sure that you're able to get those checkoffs. For the most part, I was fortunate enough to stay here local in my town. For most of them, I had like one that was kind of far away and smaller, slower site, which it was kind of worked great for me because like I started at a small site to kind of get like my foot wet to see what it was about, and then progressed into the bigger one, which that's where I work now. And I got to see both ends of the spectrum, I guess, of the workflow and all that. I would say the main thing is knowing all your knowledge, and I would say I was pretty average and pretty well versed, and had a great opportunity to have pretty good techs, which still work at my place, to teach me and show me everything that I know today. I would say that it took about one whole semester of clinicals went to kind of just like getting my foot wet of knowing how to do everything, kind of getting all the basic like X-rays, chest X-rays, 1 view, 2 view, hands, all the basic stuff. All the harder / fluoroscopy ones, those took a little bit longer. Some of them you don't even see anymore, like cystograms, and I think IVUs, which I think they removed those from the actual board that you need to get. So I would say like about your third rotation, you should have like a good, like all the quote unquote hard ones or the rare ones are the only thing kind of left. If you work, I think like the quickest anyone has been able to get done in my program when I was going to school was like two semesters worth. They were able to like complete everything, which granted there was like less students going into the program, and so like basically anything that spawned in the student got. But I would say yeah, as long as you know what you're doing and you have a good grasp. And it all kind of depends also who's the tech, because certain techs are more like old school, by the book, more like this is how it has to be. Even on like the super hard ones, I say now I'm more like, depending on what it is, like sometimes like the patients are like really hard, and I know like whatever they're gonna get, they probably won't see another one. As long as I see that they know what they're doing, and even though it's not the most like perfect textbook, like I'll still give it to them, because like I know like as a student I remember like certain stuff. Like I was back in my last semester, and the teacher was like, "Look, if you don't get this, you can't graduate." And I was like, "Oh dang." So like I remember certain of the hard ones, I'm like, yo, it's not fair, because like I could have gotten it so, but like they were like really strict, which I mean there's both sides to that story, I guess. Like if certain techs are like more strict and more harder to you, you kind of like become a better tech in a way. You kind of like master it more, but majority of the techs who've been like they were there during like some of them during film, other ones during like cassette, where like you have to have it perfectly or else you'll have to like run it and then come back, and it's like you make sure your positioning is really good, so you have to do less work, or even in traumas and stuff like that. Which I would say sometimes it is kind of good to get some of your checkups during traumas, because that kind of gives you like the real life experience if you're in the emergency room. Those come handy. But yeah, I would say about like between like 3 to 4. I mean, in our place, we rotate, I think, 3 different clinical sites. Some places offer more, some offer different. It all kind of depends on how big and all that. So some of it you can't really control. Other ones are more notorious. I guess like certain places, or I guess the techs are that kind of make or deal, or maybe it's the student. I don't know. I was a student. I was fortunate enough to have good techs. Other techs say that it's like harder for them because like where they went, it was kind of harder. So it all kind of depends. Some of it you really can't control. All you can control is like the knowledge you have to be able to perform those exams and to know it very well and ask what protocols are. Because some places, let's say it's an L spine, maybe at the prior place you just saw AP lat in the spot, and then this place they shoot obliques. So you never know. You just try to make sure you get all the protocols, so when something comes in, you already know how to do it. And yeah, it's been your boy Miguel. See you on the next one.